General practice is at the heart of the healthcare service. We find ourselves interacting with people as they come in off the street, and for the most part, 80% of the time, we're able to look after them. But we can't do it alone. We need to work together with a large team, which includes the patient most importantly, because in the end, we're here to help the patient be as healthy as they can be and to help them own their own health care. But to do that, we need to work with our nursing colleagues, with pharmacists, with allied health professionals, occupational therapists, physiotherapists, speech therapists, and a whole range of other workers. In the background, we're blessed in New Zealand with our hospital services, where we have dedicated professionals in a whole range of areas looking after highly specialized care. But this is expensive, and as a country, at this time of depression, we are really grappling with these costs. In poorer countries, and as you can hear from my accent, I was trained in Africa, nursing care is at the forefront of healthcare. Doctors are few and far between, and that is our reality here on the coast. We need to maximize the skills of all those working within the healthcare arena, and in particular the skills of parents, of individuals as they look after themselves. So we're approaching a new and exciting phase of healthcare provision here on the coast. We don't have a lot of money, and we have to start working within our means. We have a lot of resources, and we have an opportunity now to reorganize ourselves in a way that maximizes the skills and talent that we have, so that everyone can be cared for as close to their home as possible. It wasn't long ago when general practitioners developed extra skills and became specialists. Specialist surgeons, specialist physicians, specialist pediatricians and psychiatrists. There was a time when all of that work was done by general practitioners. The phase we're in now is that general practitioners are now becoming experts who support other staff in the care of patients. We're seeing the growth of nurses into a formidable workforce who are able to provide excellent care in the patient's own town and village. The system we have in South Westland is a great example of teamwork between nurses and doctors as they care for people who are really in quite remote areas. And it is the remoteness of the West Coast that provides our challenge. From Karamea to Haast is the same distance as Auckland to Wellington. The nurse in Haast is a good 2 hours away, and that is even by air. And so the skills they need are quite extensive. But with the support of technology, the ability to have a consultation using a video link has now meant that those nurses are not nearly as isolated as they used to be. This linkage through technology is even assisting us here in Grey Base Hospital. For example, we do not have any specialist radiologists at the hospital, but an X-ray taken here will be read immediately by the specialist in Christchurch as if they were here in the building, and we'll have an expert opinion on that X-ray within half an hour. Now, this is available to the nurse in Haast through the technology. Pediatrics, aged care, palliative care are now starting to use this technology in the patient's home, in the doctor's consulting room, and in the old age homes. At the bedside, cameras such as being used for this video are being able to transmit images and the voice and the consultation that's been happening to a specialist in Christchurch. This has brought expert care to the bedside in Greymouth, and this has been a major advance forward. We all need to work in a different way. As doctors, we need to learn to work with nurses to provide care. Now, for us, we get great satisfaction from working with patients, but that's a new skill that we need to learn. Likewise, those who access our care will need to be comfortable with working with a team of carers rather than one individual. And this is the world into which we're now moving. And I'm sure if we all embrace it, both professionals and the public, we'll end up with a better system than we have now that'll be more affordable for the country and provide care closer to your home, but without compromising the quality. It's for us to embrace these changes and to maximise them so that we can get the healthcare that we really, really need.